Now we look at immunizations. There are preventable diseases that we get immunizations for. Things like whooping cough or pertussis, mumps, and measles. The immunization calendar and when each person should get their immunizations changes all the time. You can refer to the recommendations put out by the Centers for Disease Control and Prevention. Acquired immunity is immunity where the body has antibodies to something, like an infectious disease or a vaccine. It can be active or passive. Active immunity, the body is exposed to an antigen, and the body actively creates immunity with antibodies. Passive is when the individual obtains the antibody from another source, like through mother's milk. Artificial active immunity. An antibody is actively made by the body by an artificial antigen like a vaccine. Natural active immunity, an antibody is actively made by the body by a natural thing like the disease itself or one that looks like it. Passive immunity is the transfer of antibodies from another human or animal to the patient. It can be natural or artificial. An example of natural passive immunity is mother to fetus through placenta or the colostrum. Artificial passive immunity includes IV IgG. Antibodies such as these immunoglobulins are given for protection from diseases, like it was done with some who acquired Ebola. Childhood immunizations include DTaP, Tdap, TD booster, HIB, RV, IPV, MMR, varicella, and a host of many more. Adult immunizations include many of the same, with an added pneumococcal. Children get the pneumococcal at one point also, which is why we see less ear infections in children. Influenza vaccine is a good case study to look at because it's trivalent, so it typically covers 3 different strains. But you can get it live or inactivated. So in the live, it's usually live and attenuated, typically nasal, still live, but reduced potency compared to the actual disease. Not given to those older than 50, although older than 50, or younger than 2 years of age. Asthmatics, those with Guillain-Barré in the past 6 weeks, 6 months, and if they've ever had it, you should really talk to the doctor. Those with antiviral treatment in the past 48 hours, pregnant patients, clients, these people shouldn't get it. And it's up to the doctor. Usually a person who is immunosuppressed will also not get a live attenuated virus. This would be a big no-no. Inactivated, they're not live, they're typically IM. This is the shot you're used to getting. Bacillis Calmette-Guerin, the BCG, is an immunization for tuberculosis. It says here live virus, but it's not actually a virus per se. It's kind of a viroid. We don't use these with immunosuppressed patients. And herd immunity is that thing that people who can't get immunizations really depend on herd immunity. When a large percentage of the community has been immunized, there will be a reduced chance of catching the disease for those unable to be immunized.